ആരോഗ്യ സംബന്ധമായ വിവരങ്ങൾ ഉൾപ്പെടുത്തിക്കൊണ്ട് ഇനി ലൈഫ് ആൻഡ് ഹെൽത്ത്.
നമസ്കാരം. ലൈഫ് ആൻഡ് ഹെൽത്തിലേക്ക് എല്ലാ പ്രിയ പ്രേക്ഷകർക്കും വീണ്ടും സ്വാഗതം. ഞാൻ റോസ് വടകര. പുളിച്ചുതേട്ടൽ അല്ലെങ്കിൽ ഹാർട്ട് ബേൺ എന്ന് പറയപ്പെടുന്ന ഗേർഡ് എന്ന രോഗാവസ്ഥ ഇന്ന് പ്രായമായവരിലും ചെറുപ്പക്കാരിലും വളരെ കോമൺ ആയി കാണുന്ന ഒരു രോഗമായി മാറിക്കഴിഞ്ഞിരിക്കുന്നു. പലർക്കും നെഞ്ചെരിച്ചിലായിട്ടാണ് ഇവ അനുഭവപ്പെടാറുള്ളത്. ഈ അസുഖത്തെ സംബന്ധിച്ചുള്ള കൂടുതൽ വിവരങ്ങൾ നമ്മോട് പങ്കുവയ്ക്കുന്നത് ഡോക്ടർ തോമസ് ജോൺ ഫ്രം ഫ്ലോറിഡ. He is a board-certified gastroenterologist with over 12 years of experience in treating patients with gastrointestinal and digestive disorders. It is a great pleasure and honor to have you in Life and Health. Welcome, Doctor.
Thank you, Rose. Thank you for having me here on Asianet.
Dr. Thomas, in our society, most of us always complain about heartburn-like symptoms, even if we eat or even if we don't eat also. Could you please help us to understand what is GERD?
So GERD, G-E-R-D, stands for gastroesophageal reflux disease, which essentially it means the reflux of the stomach contents into the esophagus with associated symptoms. The main symptoms being heartburn and acid reflux.
We talked about heartburn that happens along with GERD. Doctor, what actually happens, the functional changes that will lead to heartburn?
So the main cause is the temporary relaxation of the lower esophagus sphincter. There's a sphincter muscle that separates the esophagus and stomach. And when that muscle relaxes too much or too often, it allows the stomach contents, which is mostly acid, to come from the stomach into the esophagus. And as that acid comes up into the upper esophagus and in the mouth, that burning from the acid will then cause that burning sensation and that acid taste in the mouth.
So it only because of the medical problem this could occur, or is there any particular eating habits, or is it our own behavioral problem that causes GERD?
Yes, there are some common risk factors, including obesity. Pregnancy is a very common cause. Having a hiatal hernia, which is a small hernia in the stomach, can cause it. And then there are some factors that can also contribute to GERD, like smoking and alcohol can also cause a GERD to get worse.
Moving on to signs and symptoms. As we mentioned earlier when we defined GERD, heartburn is a very common signs and symptom with a GI issue. What are the other signs and symptoms with this gastric disorder?
So the most common symptom would be having a heartburn sensation in the middle of the chest. And the second most common would have the acid taste in the back of the mouth. But there are other common symptoms like belching, burping, nausea, throwing up, and chest pain, and non-cardiac chest pain, meaning chest pain not related to the heart. It's always important if anybody has chest pain to make sure that's not the heart. But after the heart, the number 2 cause of chest pain is GERD. So the heart needs to be checked. But after that, if the heart's okay, most of the time it is GERD.
So what kind of diagnostic tests you will perform for those patients who come to your office complaining of chest pain? How can you differentiate from the heartburn?
So most of the time, the diagnosis can be based on the symptoms. If somebody has those symptoms classically of heartburn or acid regurgitation, they're started on a group of medicines that are called proton pump inhibitors. Omeprazole is a very common one. And they're given a trial of the medicines and for about 4 to 8 weeks. And if they have an improvement in their symptoms, usually they're, that's proof that it is GERD. However, if the patient has any worrisome signs, such as they're having trouble swallowing, getting food stuck when they swallow, or they're having unexpected weight loss, or they're anemic, then, other things need to be evaluated, and they need to have an endoscopy performed to look in their stomach and in their esophagus to ensure it's not a more concerning condition like esophagus cancer, stomach cancer, those kind of things.
For our viewers, what are some of the simple tips or home remedies that can help us to prevent heartburn?
Yes, there's a lot of things people can do at home to help. I mean, the number one thing is weight loss. Even weight loss of 10 pounds can make a big difference. Other things would be, stopping the smoking, stopping alcohol, avoiding lying down after eating, avoiding eating late, and then going on an anti-reflux diet, which would be avoiding tea and coffee and chocolate. Those type of things can be very effective.
Doctor, the last question I would like to ask you about the treatment modalities. Obviously, there will be a lot of people out there who has already tried some of the measures at home, but what will you offer for those patients?
Yeah, so if the home remedies and the dietary changes aren't enough, then the medicines that we often use would be omeprazole or pantoprazole. There's 6 medicines in this group of what we call proton pump inhibitors, PPI, and they're very effective once-a-day medicine. And almost the majority of the patients who go on these medicines get relief. We give them a trial of about 4 to 8 weeks, have them come back after that time and see their response. And the majority of patients do improve. But the combination of making those lifestyle modifications and medicine is the best combination to get improvement in the GERD.
ആസിഡ് റിഫ്ലക്സിനെ പറ്റി നൽകിയ വിവരങ്ങൾ ഏവർക്കും ഉപകാരപ്പെട്ടെന്ന് പ്രതീക്ഷിക്കുന്നു. വീണ്ടും കാണാം അടുത്തയാഴ്ച മറ്റൊരു വിഷയവുമായി. വിഷിംഗ് യു ഓൾ എ വെരി ഗുഡ് ഹെൽത്ത് ആൻഡ് താങ്ക് യു ഡോക്ടർ തോമസ് ഫോർ യുവർ ടൈം വിത്ത് us on Life and Health.
Thank you, Rose.
US വീക്ക്ലി റൗണ്ടപ്പിന്റെ ഈ എപ്പിസോഡ് ഇവിടെ പൂർത്തിയാകുന്നു. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും ദയവായി ഏഷ്യനെറ്റ് US വീക്ക്ലി റൗണ്ടപ്പ് എന്ന ഫേസ്ബുക്ക് പേജിലൂടെയോ asianetusnews@gmail.com എന്ന ഇമെയിലിലൂടെയോ 7324299529 എന്ന വാട്സപ്പ് നമ്പറിലൂടെയോ ഞങ്ങളെ അറിയിക്കുക. മറ്റൊരു വൈവിധ്യമാർന്ന എപ്പിസോഡുമായി വീണ്ടും കാണാം അടുത്തയാഴ്ച. നന്ദി, നമസ്കാരം.
Namaskaram. Attorney Steve Griffiths here. Greetings to the Malayali community and blessings during these challenging times. We understand the unique character of the Kerala community, and we are here to serve your legal needs for all injuries, accident, and wrongful death cases. Call us when you need help. All consultations are confidential. Namaste.
Are you in search of a reliable tax consultant? Reach Pinky Ann Thomas CPA, a leading, highly experienced and client-friendly professional tax consultant, specialized in both individual and business income tax preparation in the USA and India. Optimize your returns and enjoy a worry-free tax season. To schedule your tax consultation, call us at 718-790-3658 or visit www.pinkyandthomascpa.com.
I am Joseph Mullapulil, broker owner of Citywide Mortgage of America Corp. We have been serving Chicago and suburbs of Illinois for the last 27 years.
We listen and prepare tax with your needs in mind. Mathew and Associates, professional accounting and income tax service in Chicago. With over 35 years of experience, our objective is to provide the clients intelligent, accurate, and cost-effective solutions to their individual and corporate tax filings in USA and India. free online e-filings and accurate tax liability analysis. Call 773-792-2117 or visit www.jbu.com.
Hello, my name is Jeremy Carden, here with Citywide Mortgage, servicing Illinois and now Florida. We're committed to serve our community, and we deliver what we promise. Call us today.